tuning into our live stream of mental health related issues and whatever's on your mind. This is again a forum for people to engage with a licensed psychologist. I'm going to wait a little bit for some people to log on and some of the live streams. Again, we're streaming live onto Facebook, Twitter, and YouTube. So tonight's topic is stress, how to handle stress, how to manage the effects of stress. Why are we all so stressed out? So we got Richard. Hey, Richard, how are you? Greetings. Thank you for logging on, Richard. Topic tonight is stress. But again, remember, that's just the topic I lead off with. So the unique thing about these broadcasts is it's not me just talking. I want to engage with people. I want people to understand that we need to normalize conversations about mental health, mental illness. Again, I'll start the way I start every live stream with. Everyone has a degree of mental illness. Everyone has a degree of something that's affecting them. Everyone has issues. So one of the main reason I'm doing this is to help normalize conversations about mental health. Okay, that's the bottom line. I'm doing this in order to help people feel comfortable talking about what's on their mind. So Richard and I exchanged a few messages about some VR reality exposure therapy he's been doing. So Richard, feel free to chime in. But again, tonight we're going to chat a little bit about stress management tools, and who of us are isn't under stress unless you've got oodles of money and you can not worry about bills and not worry about your health and have a team of doctors on hand to manage you. Sure, coronavirus is not going to be a big deal. But if you're like normal people, myself included, then, we're under a lot of stress. We're worried about, am I going to get my job back? I mean, you watch people on food lines. Just imagine going from being able to take care of yourself to all of a sudden not being able to feed your family. You talk about stress. So I'm going to remind everybody that this broadcast relies on you asking a question or making a comment so that we can interact with each other on a one-to-one basis. So one of the things we as mental health people try to do is we try to help people manage their reactions to environmental stressors and psychological and emotional stressors, because stress just isn't something that happens from the outside in. That's part of it. But stress and worry and anxiety is also very much of an internal thing, meaning that a lot of times we are worried about something. We're struggling with something on our mind. We're debating about a decision we have to make. Maybe we're regretting things we do. All of these things tend to stress people out. So we as mental health people try to help people get a handle on what's known as irrational beliefs. There's a branch of psychology called rational emotive behavior therapy. It was introduced by a psychologist. Richard is asking, how do you personally feel about cannabis for stress, anxiety, and PTSD? Great question, Richard. Let me just finish this thought. It was first introduced, rational emotive behavior therapy was introduced by a gentleman named Albert Ellis. I had the privilege of studying under him for a summer at his offices in New York City. Amazing experience. But the whole idea of rational emotive behavior therapy is you used your rational mind to dispute your irrational beliefs. So stress has a way of interjecting irrationality into a normal rational process. So let's say you might normally have a rational thought like, well, if I lose my hair, I can handle that. But if all of a sudden I'm stressed out and if other things are going on in my life, then that thought gets interrupted by, but wait a minute, what if I can handle it? Maybe I'll never date another woman again. Maybe I'll end up looking like my grandfather at an early age. And it doesn't help that when I was losing my hair, all my friends would make jokes about it, which would only stress you out more. So stress comes in and starts giving you irrational beliefs like, this is a disaster. I can't handle this. And again, if you're watching this, please share this on your timeline to pull people in, make a caption. We're talking about mental health. We're talking about mental illness. Please log on. Hi, Jamie. Yeah, rational emotive behavior therapy, REBT, rational emotive behavior therapy. And it's about using your rational mind to dispute irrational beliefs. And stress is a psychological and emotional reaction to the environment, which stresses one person out may not stress another person out. I may be sitting in traffic, banging on my dashboard. What the is going on? Why I hate this traffic? Maybe Jamie or Richard are in the other car, listening to a podcast, relaxing, enjoying some time away from being at the office or just time to themselves. It's all a matter of how we react to the environment. And people, yes, rational emotive behavior therapy. Just type in Albert Ellis and it'll come up. He was the originator of it. But the idea of rational emotive behavior therapy is, and I've talked about this before, it's got the ABCs of thinking embedded in it. ABC is an acronym for activating event, belief, consequence. A is activating event, B is belief, C is consequence. So how that works is we get stressed out about something. We get activated by something. We then impose a belief upon that. And then that belief has a consequence in the form of feelings. So again, guys, if you're watching this, please share this so we can pull some more people in. Ask some questions. I'm going to get to Richard's question in a second because it's a great one. But what we try to do is we try to help our clients work through the behaviors that they're imposing upon their activating event. Now, why is that important? Again, take my example about losing my hair. Pretty significant event. I mean, if you knew me when I was younger, I had a big, thick, curly head of hair that I loved. And so when I started losing my hair, I started believing a lot of things about losing my hair. Now, losing your hair, losing protein strands in your head is different than somebody who's going through a major activating event. So, hey, Jennifer, how are you? Great. I'm glad that this is something that is in your homework between therapy sessions. Beautiful. Glad you're proud of getting therapy, Jennifer. That's like being proud of going to the dentist or going to the orthopedist. Be proud of the fact that you're working on yourself. We'd have a totally different world if people were working on their issues, if people were questioning their belief systems. So we're talking about stress tonight. So one of the things that helps when you're under stress is to start beginning to question how you're reacting to the stress, meaning not only physically reacting, like I said, punching the dashboard if you're in traffic, but psychologically. One of the things people do is they hate stress. They hate it. They get under stress. Oh, I hate that. I'm like, hey. And that negative emotion that they're bringing to the stress is going to magnify it. Okay. So when you're under stress, you've got to begin being aware of how you're reacting to the stress. Now, mindfulness, okay? Everyone's heard of mindfulness. Not everyone, but mindfulness is a Buddhist concept where you become aware of your surroundings and you become aware of your breathing. All good stuff. Psychologists have been using it for many, many years, and maybe they got it from Buddhism, I don't know, but we call it metacognition. Metacognition is thinking about your thinking, being aware of your thoughts and emotions. Now, why is that important? Think about it. I mean, if you become aware, and again, guys, if you're watching this or just tuning in, we're talking about stress. My name's Dr. Stephen Walker. I'm a licensed clinical psychologist. Please share this on your timeline. Be proud of the fact that you're working on your mental illness, mental health. We all have a degree of mental illness. That idea of mental illness is such a stigmatized thing only because people associate it with extreme forms of mental illness. We don't look at mental illness in terms of a degree. And that's what I keep pressing and pushing here, that we've got to work on our degree of mental illness. And one of the degrees of mental illness that many of us have is coping with stress. We don't have good coping mechanisms. We have anger. We get PO'd at stress. We get easily triggered by something. the stress that everyone in this country is going through right now, I know everyone in the world, I've actually called it planetary paranoia. We're all paranoid. We go out. If you were a germaphobe before, oh, good God Almighty, you must be a stress to the max. Stress feeds off of a fear of the future, meaning that you are convinced that you're going to contract coronavirus, or if you contract coronavirus, you're going to die. And if you die, how that's going to happen. I was talking in some of my previous broadcasts about how back in March, I was severely ill, not intubated and respirator, not that level, but 2 emergency room visits for somebody who hasn't been to an emergency room since I broke my arm when I was, 6 years old. So I was under a lot of stress because I was worried. It was the first time I was severely sick like that ever. And of course, it has to coincide when I'm married and have a 4-year-old. So the stress, the added stress I was under, compounded my experience of what I was feeling. And yes, many studies are coming out with stress being an immunosuppressor, meaning that it suppresses our immune response. So we need to work on our stress and our reactions to stress. So I'm going to pause here for a second and get to Richard's question. Richard is asking, how do you personally feel about cannabis for stress, anxiety, and PTSD? Great question. How do I feel about it? Look, I'm all for medications that are more natural than chemically processed. Now, that being said, overuse of marijuana, look it up, is associated with psychosis and extreme levels of paranoia and lethargy, meaning that you don't want to do anything. So the question again is, how do I personally feel about cannabis for stress and anxiety and PTSD? Under the right dose, while you're working on whatever is stressing you out and making you anxious, and whatever PTSD, again, post-traumatic stress disorder, whatever PTSD, if you're combining that with some therapy, I'm all for it. But if you're using cannabis to just numb yourself and just to not think about those traumatic memories, then I don't think that's a good idea, because what can happen is marijuana can also activate anxiety and negative emotion in you to the point where you could even have flashbacks and revisit things that happened when you were, hey, Angie, how are you? Again, guys, please ask some questions. This works if you guys interact with me. So yes, how do I feel about cannabis for stress and anxiety and PTSD? If it's dosed correctly, if you're not becoming dependent on it, if you're not using it to numb yourself, then I'm all for it. But you've got to find the right dosage. If you're waking and baking, meaning waking up and getting high every day and all day long, and that's all you're doing, then I don't think that's a good tool for you. If you feel that marijuana is making you more anxious or more hypervigilant and worried about something negative happening, then I would not recommend that. Why? Because marijuana has a way of affecting our fears. A lot of times people will get high and they will, if they have underlying anxiety or fears, then sometimes that will get activated even more. Hey, Diego, I'll get to that. It's a good question, man. Let me finish up with this question about marijuana and stress. The key, guys, is you have to interact with your medications, whether that's you got a medical marijuana card, you got a prescription for Xanax, whatever it is, a pain reliever. You've got to interact with the medication. What do I mean by that? You have to figure out what dose is good for you. A lot of times these painkillers are prescribed to people by doctors telling them, oh, no, take it before you feel any pain. Listen, that is the absolute worst thing you can do with a painkiller. Take it before you feel pain, because you're never going to have a baseline about how much pain you can manage. Pain is not something so I'm getting off a little bit here. So let me just reel myself back in. What I was going to say is pain has been stigmatized by our culture as something to avoid and kill. And it's a multi-billion-dollar industry a year stigmatizing pain. This is why we have the opioid epidemic, because people are not willing to allow themselves to feel some pain. Whatever happened, that old adage when working out, no pain, no gain. It's the same thing with emotional and psychological pain. You've got to have a certain amount of stress in order to strengthen yourself. I mean, the whole idea behind growing muscles is stress and tension on the muscle. Too much, though, and you tear the muscle. It's the same thing with medication. You've got to interact with your medication and find out what is a doable amount. So, Richard, you're asking me about cannabis for stress and anxiety. I don't know if you're still on, but if you are on, shoot me a follow-up. Are you using it to manage stress and anxiety? Tell us how that's working for you. Again, guys, if you're just logging on, please share this. This is my attempt to normalize conversations about mental health and mental illness. We need to normalize and have conversations about mental health and mental illness with in the same manner that you discuss your oral health or your physical health. There's nothing wrong with it. Again, please share this or ask a question. So I'll look for a follow-up from you, Richard, about whether or not you're using cannabis for stress and anxiety and PTSD, and I'd like to hear how it's affecting you. Hey, Melissa, how are you? I hope things are leveling out for you. Hey, Miranda, thanks for joining us. Again, give us some follow-ups from the night before. If you're a member of any groups, if you're a member of any mental health groups or whatever, please share this. Hey, Severina, good to see you. I appreciate everyone logging back on. Please share this live into your groups if you're into any kind of mental health groups or any groups that you think might help. Because remember, this is an attempt to normalize conversations about mental health. We need to talk about it the way we talk about our physical health. So Diego is asking, let me bring the question up. Could the stress someone feels be associated with or with the fear of being judged? Excellent question. Excellent question. Absolutely. A lot of times we are afraid of being judged. We stress ourselves out. And, the interesting thing, Diego, about being judged is, I don't know if people have ever thought about this, but being judged, the fear of being judged a lot of times is basically a projection outward, meaning that if you are in a habit of negatively judging yourself, if you're in the habit of putting yourself down a lot, guess what you think other people are thinking about you? Exactly. You're projecting that outward onto them, meaning if you hate yourself, if you think, my bald head or whatever isn't perfect, then again, I'm going to immediately assume that that's what people are thinking of me. So again, real quick, guys, please share this. So yes, absolutely. People have a fear of being judged. And it's interesting, you see this stuff on social media. I don't give two F's about what people think of me, and I don't care about being liked. Well, let me tell you something, people. Facebook would not be Facebook, and the genius behind Facebook was the like button, meaning that the ability to get a behavioral response, a positive behavioral response about something you posted. That is an addictive thing. Anyone who's on Facebook saying they don't care about being liked is ridiculous. Do I want my people close to me to like me? Abso-friggin-lutely. Is it required for my patients to like me? Absolutely. Why? Because if they like me, if they feel a connection with me, because I genuinely like them, I love, and I don't mean in a weird, strange way. I love the people I work with. Why? Because they're working on themselves. They're saying, I have these issues and I need to work on them. And again, people, what kind of world would we have if everyone, or even more than 50% of the population was actively working on their issues? Think about it. Think about the world we would have if people were saying, why am I hating this black dude? Or why am I hating this white guy? Or why am I hating this Jewish dude because I'm Muslim? Or why am I hating this Muslim dude because I'm Jewish? Imagine if people start questioning those beliefs. we would have a more of an enlightened society. So getting back to Diego's question, sorry, I go off on these rants, but Diego's asking, can stress be associated with the fear of being judged? Absolutely. But Diego, what I would say to you, my brother, is how is Diego judging himself? You know, Diego has been very honest about some of the trauma he went through when he was a kid. If you went through any form of abuse, if you are, yes, Severina, thank you. We're in need of some feedback. Come on, people, ask some questions. Don't be shy. This is about interacting with a mental health professional so that you can understand there's nothing woo about this. This is about talking to another human being who's trained, who has experience to help you. This is not Dr. Phil or girl and boy, you better, and I'm the expert and you better look at me. That's such BS. That's not what therapy is. Therapy is about you talking, me giving you feedback, we exposing you to what you're afraid of and getting tools to manage it and heal. That's how we heal. Nothing is served by holding things in. Nothing. That is akin to having food poisoning and holding it in. You're going to get sicker. Same thing with emotional pain. But again, guess what? Oh no, I'm not allowed to be weak. I'm not allowed to have issues. Anyway, so Diego's following up. Diego's great, by the way. He and the other people who have been loyal followers here. Thank you. So Diego's saying, again, I realized that at one time I had that. Now I come to terms that everyone judges. Absolutely. Ironic is another friend of mine has that outward projection. Exactly. I seem to discover that I peel layers continuously. Beautiful. Absolutely, Diego. Keep peeling back those layers, bro. But remember, your relationship with Diego has to be on your radar, almost like I know I used, before I had a kid, I would always say your relationship with yourself is the most important. But, my relationship with my 4-year-old is pretty up there too. But again, think about it. If I hate myself, if I'm in a constant state of, oh, you're such a loser and putting myself down, what kind of father am I going to be? What kind of example am I going to be putting out to other people, putting out to him? So we've got to work on our relationship with ourselves. If we're afraid of being judged, then odds are you are negatively judging yourself. You are putting yourself down in a way that makes you feel bad about you. So you assume other people are feeling bad about you. And I posted a meme years ago about, let me see if I can pull it up here. I just realized that this program allows me to share here it is. So let me see if I can do this. Let's see here. So can you guys see this? It's a meme that I put up basically saying, unless you're a perfect, issue-free, completely well-adjusted individual, please stop judging other people, because if you were a perfect, issue-free, completely well-adjusted person, you wouldn't be judging other people. And that's what people forget, okay? People forget that the people that they're worried about judging are the ones, or the people who you're worried about that are judging you are the ones that are the imperfect people. So I'm actually worried about someone judging me when they're as insecure or they're as needy or they're as whatever as I am. So what I'd like you guys to think about is this. Your judgments of yourself are stressing you out, okay? You judging you is what's stressing you out, meaning you're feeling as though there's something wrong with you is what is stressing you out. Again, guys, please, thank you for sharing this. Please bring in some more people. If you're new to this broadcast, this is us talking about mental health, mental illness. There's nothing wrong with it. Everyone has a degree of mental illness. Yes, even me. Yes, I did not grow up in the healthiest environment. No, I decided I was not going to stay stuck and dependent and worried about getting a job and all of that, like certain people I know in my family. That being said, we need to work on our issues. We need to work on our pain, okay? So yes, Diego, if you're worried about being judged, we need to look at how you're judging yourself, okay? So let me get to some more questions here. Angie's asking, shifting gears here a little bit. I talked to my son about what we talked about last week, He is definitely feeling like he's different. He's worried he won't be able to get a girlfriend. I'm laughing a bit here because he's only 13, but I listened and empathized with him. He's doing a bit better. He only yelled at me once today and came back and apologized later. Beautiful. We talked about things he can do to get his anger out. Beautiful. And he did use those today. Outstanding, Angie. He's been talking more to me each time he has a problem. I feel like it's a step in the right direction. Beautiful. Gave me some goosebumps, man. That's beautiful, Angie. I'm glad that people who are tuning in are taking the advice and seeing if it works in their world. Is it going to work all the time? No. But the key that Angie, I think, keyed in on is empathy. Empathy, feeling empathy for a person in your life who's hurting. Remember, empathy is not agreeing with the person, okay? Empathy is trying to understand them, trying to feel for them, okay? Angie, if you're interested in a book, I recommended this book to a client today. It's on my phone, so I can't. But anyway, the name of the book is Nonviolent Communication, okay? Nonviolent communication. It's a way of communicating with people in your life in a very empathetic way where you are able to communicate to them in an empathetic way. It was written by a gentleman who did Middle East peace talks and all that. But it's great to hear, Angie, that you are applying these things and you're seeing a result. But Angie, remember, you've also got to apply them to you. You've got to really work on Angie's relationship to Angie. You've got to give yourself some credit tonight when you're lying in bed that you love your son and you're trying to help him and you've always been a good mom. I know you talked about people telling you that you're the reason his son this and that, and I don't know why people are telling you that. But Angie, you've got to forgive yourself, and that takes time, and I know that's a cliche, but forgiving yourself means owning what you did and then being able to work it through in a way that helps you heal. How to communicate like a Buddhist is also a good one. Okay, I'll check that out. Excellent. How to communicate like a Buddhist. That's great. Buddhism isn't just a religion, guys. Buddhism is a philosophy, is a psychology of the mind. There's a lot of great. I'm not trying to convert anyone to Buddhism, but Buddhism is a great way because the whole concept of mindfulness is straight out of Buddhism. That's what Buddhists do. They try to be aware of, they breathe, they meditate, and then they try to be aware of their thoughts and emotions. And that's another thing we can do one night. Meditation is a huge part of what I work with clients on, giving them tools to learn how to relax, learn how to control their breathing, learn when maybe we can do that one night, and I can run you guys through a meditation that you can use in the moment. But getting back to Angie, I always tell my kids that nobody is looking at them as closely as they are looking at themselves. Excellent. But I have a hard time with that myself. Exactly. A lot of times it is difficult to follow our own advice. I see myself as worthless and assume I'm worthless to everyone else. Bingo, sister. Exactly what I was talking to Diego about. You're projecting your own feelings of worthlessness onto other people and assuming that that's what they're going to do. I call that spotting your projection. And by the way, I'm sure that there will be self-helpers logging on here using a lot of these and claiming this is their ideas. Nice try. I own domain names for most of these concepts that I've been working with for years. But Angie, you got to work on repairing what happened to you early on, healing what happened to you early on that caused you to feel worthless. I'm guessing that, there was some trauma. I think we've talked about that. I'm guessing that trauma is still kind of pumping out infection in you, which is making you feel worthless. Angie, you've got to remember, we talked about stress, and Diego raised an excellent point about judgment, fear of judgment stressing us out. You're stressing yourself out, sister. Your feelings of worthlessness are learned behavior, okay? They're learned behavior. You've got to start looking at that learned behavior like, that's interesting. I mean, Really, what have I done to deserve feeling worthless? I mean, totally worthless. So you're saying that and again, self-esteem is also, people have self-esteem on a black or white too. It's either I have high self-esteem or I have low self-esteem. It ain't like that, guys. High and low are the ends of the continuum. Remember, everything is a matter of degrees. So Angie, if I was working with you, I would ask you questions like, well, what are some things you like about yourself? What are some things that you feel good about yourself? That's what I would get you to start focusing on. You've got to start bringing some nuance to the idea that you're worthless, because that's stress. That is a form of internal stress when you're asking yourself, when you're basically telling yourself you're worthless. Everybody has value. Everybody is born with value. This is something that RABT, Albert Ellis talks about, that inherently we have value. Okay, we have value as human beings, but we allow our conditioning, we allow the traumas that we've had to affect our ability to believe that we have value. And that's the sad part, because we are letting abusers continue to abuse ourselves. And I've said this for years. If you were abused as a child, it's almost guaranteed that you abuse yourself internally, that you have a negative relationship with yourself. Again, guys, please ask some questions, okay? Angie is the last person that's asked a question. Please, if you're watching this, if you're a new viewer, please do not be afraid of asking a question. You have nothing to be ashamed of if you're working on your mental illness or mental health. That is something to celebrate. That is something to be proud of, just like you'd be proud of working on your physical health. So please ask some questions. So Angie, yes, you are stressing yourself out, sister. You're stressing yourself out by telling yourself you're worthless. You're not worthless. If you want to find out how worthy you are, ask your son how valuable you are to him if you need a little external validation. But the key thing that I would want to work with you on, Angie, is where did you learn that you were worthless? Like, where did you pick that up? Like, why? What happened to you growing up that made you feel worthless? Now, remember, when I say what happened to you, I'm talking about you being the victim of abuse. When you imagine this for a second, Angie. So let's say you were going to work at a domestic shelter or battery or a women's center who were battered or abused. And you walked in there and you looked at some of those victims of abuse and you said to them, you guys are all worthless. You're completely worthless. You have no value. Imagine talking to those victims like that. Well, what kind of effect would that have on them? Exactly. You're doing that to yourself, sister. You're doing what, many of you guys have heard is called victim bashing. You're bashing the victim. You're telling yourself that there's something wrong with you, that you are the reason that you got abused. That is what you need to work on. You're judging yourself and putting yourself down, and you're expecting to feel better about yourself. That's not going to happen, okay? You've got to work on the parts of you that are still hurting. You've got to work on the part of you that is still feeling worthless, because until you start exposing yourself to that, you're not going to really heal. So what I would encourage you to do, Angie, is what you're doing with your son, the way you're talking to your son, you got to start talking to yourself that way. And getting back to your son, you've got to work on this daily. You got to check in with him every day, not be, oppressive, but I would highly recommend that every day you guys check in. Remember, prevention, preventativepsychology.com. Again, one of my feeder domains. It's easier to prevent these types of things from happening before they actually happen. If you think about a fire, it's easier to prevent a fire than to put a fire out. Your son is just beginning to crack a little in a positive way, meaning he's beginning to crack through some of that stuff that he's worried about. Like he's worried that he won't get a girlfriend. And I know you laugh, but trust me, if he's going through puberty and his friends are coming into school talking about, oh, I messed around with this person, I messed around with that person, or I got this date or whatever, he's going to feel that he's going to feel stress. He's going to be worried that he's not going to be able to get a girlfriend. So I would encourage you to continue empathizing with him. Say, oh, buddy, that must be hard thinking, because of your diabetes or because of your whatever that makes you feel different, that you must worry about being able to get a girlfriend. That must really suck. Try to maybe relate a story to him when you were 13, what you were going through. Remember, empathy is only about feeling. It's not agreeing. So I want to just get back to the topic we were talking about before. Again, please ask some questions about anything you want. It doesn't have to be about the topic. I come in with a topic so that, maybe there's some questions about it. But if you want to go off the topic and say, hey, how do I handle a sexual addiction or whatever? And I had somebody send me a good question about anxiety that their husband is going through. So that can stress people out, being a primary caregiver for somebody. If you are being stressed out by being a primary caregiver for somebody, or if somebody in your family has a mental illness or is not working, has an addiction, you're gonna feel that stress. You've got to work on giving yourself, you heard this term, self-care. What does that mean? Whatever you need to feel balanced, whatever you need, facial, working out, playing golf, watching football, whatever it may be, whatever you get enjoyment out of something is technically called self-care. Now, that's external self-care. Internal self-care is, again, like I've talked about before, your relationship with yourself. How do you treat yourself? Are you able to say good things to yourself? Or like with Angie, is the fact that you are in such a negative place with yourself, it's probably difficult for you to identify good things about you. So stress is a psychological and emotional reaction to either an external stressor or an internal stressor. That is one of the main things that stress is, meaning that you are perceiving something in your world as stressing you out. The key is in that moment, remember, ABCs, activating event, belief, consequence. You've got to question the beliefs about what you're stressing you out. Thanks, Rose. I'll get to you in a sec. Again, using the example of rush hour traffic, or in the moment, why am I letting this stress me out? Why am I allowing this situation to control my inner world? Now, in the beginning, that's going to seem like a platitude, meaning it's going to seem very insignificant. The more you question your belief system, the more you're motivated to look at how you got conditioned, the more that conditioning starts eroding, because it cannot hold up under, well, wait a minute, I'm, again, taking racism. I'm going to hate this person because that's what I was told or that's what I was taught. It doesn't hold up if you're motivated. Okay, let's get to Rose's question. Thank you, Rose. Is it possible for someone who has been through trauma and mental illness to possibly turn around to one day down the road and go back to school and become a psychologist themselves? Absolutely. I ask this because I love psychology, but every time I try to go back to school, I underestimate myself and let fear take over because of all the trauma that holds me back from and makes me look weak. Let me tell you something, Rose. Miranda, I'll get to you in a second. Thank you for the questions. What you just basically said is what got me into the field of psychology. It sounds like you went through more trauma than me. I was not, we were hit, 70s and 80s, but there was no real overt physical abuse. And to my recollection, and it's possible I'm repressing it, but I don't think I am because I have a damn good memory about my childhood, I was never sexually abused. But what we went through was a great deal of emotional and psychological neglect, being left home alone a lot, being shelved away into relatives' house for extended periods of times. My father was basically a functional alcoholic. But anyway, I could go on and on about that, and I can talk freely about it because I've worked on it. So absolutely, Rose, if you can continue working on your trauma and get it healed to a point where you feel it's manageable, then absolutely, absolutely, it can be something you draw on, because I draw on a lot of my own pain, a lot of the stuff I went through and have subsequently healed, to try to motivate people into believing that they can heal, which is a key part of any treatment process, whether it's medical, psychological, whatever it may be. If you don't believe you can be healed, if you don't believe that you can heal, then it's going to affect how you relate to yourself. It's going to affect how you relate to other people. So yes, Rose, absolutely, you can go back to school. I went back and got my master's. Long history how I got into this, but real quick, I was in business for many years, felt completely like just getting into my mid-20s, did not like where my life was going, gave away every possession I owned, moved down to the Caribbean where my mother's family's from, went to work teaching at a private school for $8 an hour as a teacher's aide. Yes, in my late 20s, exactly, early 30s. Loved it, found out I loved teaching. Then I got my master's degree. Then I went on and got my doctoral degree in my mid to late 30s. And then subsequently, I've been doing this work, teaching and counseling since my early 30s. So absolutely, Rose, you can go back to school and work on yourself at the same time. But what I would be interested to talk to you about is this statement about letting fear take over you, and then that makes you doubt yourself. That is a key component. Again, guys, please share this if you're watching this. That is a key component that I would focus you in on, like managing the doubt. If the trauma is making you afraid of failure, then that's a key thing I would focus in on. I would focus in for you on, where did I learn to be afraid of failure? Is the trauma you went through associated with somebody beating you down and telling you you are okay? She's saying fear of failing always intimidates me. Well, sister, you need to start exposing yourself to some failure in order to manage it. And I'm not talking about flooding yourself, but the only way you're going to transcend your fear of failure is to fail and realize this is dealable. I can handle this. And I brought up a few talks ago about Edison, Thomas Edison, and his famous quote when he was asked, well, Dr. Edison, you failed, I don't know, it was 40 times. And remember, failing back in Edison days is start from scratch, make all my ingredients. Didn't you ever want to give up? Didn't you feel like it wasn't going to work? And he looked at the guy like kind of like quizzically, like, what are you talking about? I learned 40 ways it didn't work. That is the Edison, I call it the Edison mentality, meaning that you've got to develop a relationship with failure in a different way. That failure, you need, like, take, for example, me in this incarnation of Dr. Stephen Walker at 55 years old. My failures got me here. I failed along the way. It wasn't all failure, but every time I failed, I learned from that, and that got me higher and higher. So absolutely, Rose, you got to do a little bit more work on how the trauma is making you feel that you're afraid to fail. You got to look at, who taught me that? When I failed as a little girl, was I beaten? Was I told I was a loser? Was I told that I'm going to always turn out to be a failure? What conditioning is still affecting you? And if it's trauma, if you impose trauma with conditioning, well, that's a difficult one to work through. Not impossible, because everyone has the capacity to heal. I absolutely believe that. Anybody who wants to heal can heal. It just takes work. And Rose, you've got to start exposing yourself more to whatever trauma you went through. Okay, Rose said earlier, validation is not necessary when you love yourself. Enough memories of judgment matters, except that when you have reflection of the mirror. But right, Rose, but remember, loving yourself is the end game. Most people aren't even at liking themselves. Most people aren't even. One of the things I help work people through is a series of 4 steps. It's self-awareness, self-acceptance, and those kind of flip-flop once in a while. That moves into self-liking, and then that moves into naturally into self-love. And do you always love yourself? No. You've got to accept the fact that it's going to ebb and flow. There are going to be times when you love yourself. There are going to be times when you're not crazy about yourself. But you can't let that affect you and hold you back. So Rose, thank you for your input here. My advice to you is, yes, absolutely, you can be a psychologist or a counselor if you've been through trauma. The problem is, though, you've got to monitor how it bleeds out into clients. Like a lot of people, there are a lot of people posting all this stuff about narcissism. And I'll tell you what, man, you listen to them and all you keep thinking is, man, somebody hurt you. And you haven't healed from that. You may think posting things on YouTube and getting great tens of thousands of people to view it, more power to you. But that ain't helping. That's helping you. That may be helping you, but that wound is still pumping out in you because you can see it in their face. They're still angry. They post things like 10 ways to get even with a narcissist, or 8 things that will screw a narcissist's mind up. And that revenge, that vengeful thing, is clearly an indication that you have not worked on your issues. And a lot of these people are coaches, okay? No mental health training, absolutely no training in the field, and they're giving people mental health advice. Where's the regulation, okay? So anyway, Rose, absolutely do not give up on your dream. I don't know how old you are, but do not give up on your dream. Keep working on healing from that trauma. Don't victim bash. Don't tell yourself, oh, I should be over this by now, and what's the matter with me? Try not to do any of that. Okay, so thank you. That was a great question. Miranda is asking, how do you deal with people that can't handle it when you step up and stop taking shit from them, from everyone, even ones that tell you stand up for yourself, stop letting people take advantage of you. But the moment you do this, it's not okay. I don't know if I'm coming or going anymore. So my go-to emotion for everything is tears. And I feel like all that does is make me look weak. Okay, great question. So how do you deal with people that can't handle it when you step up and stop taking crap from them or everyone? So that would be my first question. If I'm involved in a relationship where I'm standing up for myself, is I would ask the person, not in a confrontational arguing way, why you've been encouraging me to stand up for myself and now you're upset that I'm doing it. What's going on? Why are you giving me conflicting messages? Now remember, what I just did is assuming that you can engage with the person. Sometimes you can engage with people. Sometimes you can't talk to them. But what I would recommend to you is you've got to start working from an inside out perspective. Yeah, it's a movie and it was written by psychologists and I wish it was never written, but some of us have been talking about this for years. Inside out, meaning let me start from inside of me. Why do I need them to handle when I stop taking crap from them? Why is their opinion? Why I like the fact that I'm standing up for myself. You don't like it? Let's talk about it. If I'm being too mean or if I'm being too aggressive, then please tell me. Again, guys, please share this. If you're just logging on, we're talking about stress. We're talking about mental health and mental illness. There's nothing wrong with it. Everyone has a degree of mental illness. Think of one person you know who doesn't have issues. Think of one person. I bet you can't. I bet you can't think of one person who doesn't have issues. So why the hell are we all so ashamed of talking about it? And Miranda hit on it. I don't want to look weak. Why is weakness stigmatized in our society? Everyone has weaknesses. Everyone. Okay? So Miranda, what I would encourage you to do is continue soothing yourself. Don't stigmatize your crying, your emotions, your ability to emote. The fact, and I say this to my clients all the time, the fact that you can feel emotional pain means you're healthy. The fact that you can feel emotional pain means you're healthy. What does that mean? Well, obviously, now that I've said it, it's obvious, right? If you cannot feel emotional pain, beware of people like that. because those are the ones picking up the AR-15s. Those are the ones strapping bombs on them. Those are the ones who are so devoid of emotional intelligence and expression that they have no empathy for other people. So Miranda, stop stigmatizing your crying, you're feeling hurt. That's a healthy thing. Your weakness, everybody has weakness. There's nothing wrong with weakness. It's okay, but you got to manage it. Yeah, you got to manage it. Sometimes maybe it's not, hold back the tears, not out of fear, but out of strategy, knowing that if I cry right now, I'm going to lose sort of power or whatever. In that moment, don't cry. Hold it in, but remind yourself there's nothing wrong with it. But the thing I would encourage you to do, sister, is this. If you're starting to draw boundaries with people, and say, I am not going to take your crap anymore. And if you're in a cycle with somebody who, oh, I'm so sorry, no change in behavior, you give them a chance. Oh, I'm so sorry, no change in behavior. You got to decide at some point whether or not that's healthy for you. So please keep standing up for Miranda. Please keep not taking crap from people. Now, I don't mean I don't care about anybody and I don't give two Fs and all of that. I'm not talking about any of that because that is complete nonsense. Not caring is not healthy. If our society keeps moving in the direction of I don't have two Fs to give and I don't care about this and I don't care about that, strap on, people, because it ain't going to be pretty. We need to care more, but we need to learn how to manage empathy. We need to learn how to manage our emotions, and we absolutely mother blanking have to start managing our reactions. We have to start managing how we're reacting to people more. Okay? I have my moments too. Trust me. Okay? But we need to work on it. So Miranda, hats off to you. Keep standing up for yourself. Keep making it clear that there's a new sheriff in town. And if you're going to disrespect me and if you're going to put me down, you ain't going to be in my life. All right. So let's see here if any other questions came in. Miranda's following up. Okay, Frederick. Thanks, Frederick. Absolutely, man. I hear you. It's hard for me sometimes to not sound, arrogant or egotistical, Frederick. But yeah, all these self-styled narcissism experts, listen, they got way more so far. I'm going to catch up, but they've got way more followers and way more views, but they are literally leading people down the wrong road, because what they're leading people down is a path that they haven't even healed on. And I think it was Rose who asked me earlier about being a psychologist once she heals some of this emotional trauma. That's the road they're on. You should be on, because what these experts are doing are they're saying, well, I know how to heal you. I know what advice to give you when it comes to narcissism and all this. Can I see your training on that, please? Can I see where you have worked with patients on narcissism and what what kind of science are you using? I mean, sure, you can break every mental illness down into multiple different things, but yes, Frederick, I hear you, man. So let me just get back to Severina. Severina was asking a question. She broke it up. I've noticed that when I get into a relationship, I usually am the one that I know that they like me. I lose interest and I don't want to be there anymore. It may be associated with my past relationship is like I get when I want it and it's just there. So yeah, this is a common thing. This idea that, okay, Miranda, I'll get back to you in a second. Thanks for the follow-up. And Richard just followed up with his question about marijuana. This is something that a lot of people talk about, is that they don't seem, when they're getting chased, they're in love with a person but when they when they're chasing a person, they really want them. But then when they get them, now all of a sudden they've lost interest. This is a very common thing. What usually this is stemming out of is what's called an intermittent reward cycle. meaning that they're, and I don't want to get too technical here, but it's coming out of their past. Because what happens is, imagine for a second if I was going to try to condition a mouse to press a lever over and over, even when he doesn't get or he or she doesn't get a reward. How would I train the mouse to press the lever over and over and over? Well, some people would say, just give them a reward and then stop it. No, because when you do that, that extinguishes the behavior. The way you condition a mouse to continue to press a lever over and over and over is by doing the reward intermittently, meaning you give it 2 or 3 times, then you stop 4 or 5, then you give it to a 1 or 2, then you stop, and then you stretch it out and stretch it out and stretch it out to the point where they're in their mind, I'm going to get it, I'm going to get it, I'm going to get it, I'm going to get it. I've noticed that there's a correlation between that and getting what you want and then not wanting it, because the intermittent reward cycle is keeping you hooked on them coming at you. Like sometimes you may think, well, do they like me or do they don't like me or do they like me or do they don't like me? But then once you know they like you, now you're missing that fluctuation. And what that usually is stemming out of is crap from your past. You had a parent that was intermittently loving you, meaning that maybe they loved you, but then they were treating you like horrible, or maybe their love or their attention was inconsistent. So what I would recommend for you, Severina, is you got to start working on some of this stuff that is causing you to perceive being loved, wanted, as not interesting to you. Like, why is it that knowing that the man loves you, all of a sudden you lose interest? What's going on there? Why do you need to not know how they feel in order to be interested? You know, these are deep questions, guys, that we have to work on in order to get answers to. And the only way to do that is to explore it, to begin getting into it. So that's a really great question. I would encourage you, Severina, to look at the belief system you have about being loved. What is going on with that? Why is it that when you're loved, you don't feel like, oh man, that's so great. That is so great. I feel so secure now. Why isn't that the feeling you're pursuing? Why are you pursuing, or why are you in need of the feeling of not knowing whether you're loved? You know, we are such deep, complex beings. If you think of our mind as this like universe of connections that is being affected our whole life, this is why I am such an advocate of finding somebody licensed, trained, to help you with the nuances of whatever you're working on. Because it's not just advice giving. It's not just, oh, here are the 8 ways that you can screw with a narcissist's mind. Or the 10 signs that you're with a narcissist. Why do you need 10 signs? The basic, the number one sign if you're with a narcissist is lack of empathy. If you're with somebody who doesn't have a lot of empathy for you, meaning that you genuinely feel that they don't care about you, that your needs are not important to them, and it's all about them, then your odds are you're with a narcissist. What more do you need? What more proof do you need? See, this is what people who aren't trained in the field don't get, is there are key parts of a mental illness that you have to have the diagnosis of a mental illness. Narcissism relies on lack of empathy. You could have narcissistic traits, but if you have empathy, if you feel for another person, you're not a narcissist. You're not. You may have narcissistic qualities, but you're not a narcissist. This is what they're not telling you. They want to get views and they want to get people interested in this idea that, oh, sorry, I'm going off. Let me reboot here. Sorry. But I'm really passionate about this, guys. I mean, you guys might think, oh, well, this is just how you are online. No, talk to any of my clients. This is the kind of energy I bring because I really believe we as a culture are not really living up to our potential. We should be beyond crap like killing each other. We should be beyond racism. We should be beyond suicide. I mean, think of that, killing yourself because you believe there's no hope. I mean, this is stuff that we need to get beyond. And the only way it's going to work is if people are working on themselves. Okay. Let me just, before I close here, let me go back. Miranda is following up and saying the tears are because I don't know where to go with my feelings of anger because I feel like I'm not allowed to be mad. I get mad, then I'm told I'm too sensitive or taking things too personally. The mark of an abuser, guys. I'm going to punch you in the face. Dude, why are you bleeding? Why are you crying? Why you're so sensitive? Punch you again. Oh, whoa, now you're bruising? What's the matter with you? It's the same thing they do with psychological and emotional. They'll insult you, they'll be mean to you, and then they'll say, oh, you're taking it, you're so sensitive. Oh, what are you, a snowflake? These abusers, man, they're good at making you feel that you're the problem. So Miranda, you're not the problem, sister. You need to get yourself into a place where you feel that you can live without these people who are causing you pain if they continue to cause you pain. Give them a chance. I've given people chances my entire life. It's only recently that I've begun saying, no, you're going to continue doing it. You're going to continue violating my boundaries. You're going to continue stirring problems up in me and in my family. Work on yourself, own it, come talk to me about it, and then we'll talk about it again. But until people are willing to do that, you might have to create some boundaries, Miranda. Let me see. Diego is saying your childhood is similar to mine. The one key takeaway is the relation with me. Exactly. Your relationship with yourself. You said something earlier that caught my attention. And yes, my dad beat me, which caused me to be afraid. Exactly. Beatings like that are an intermittent reward cycle, meaning I don't know when it's coming. Is Jekyll or Hyde? That anxiety, that fear gets bred into you as a little kid, and you start being like, whoa. That was back then. I just don't feel much like that anymore. Beautiful, Diego. And Diego talked about in a previous broadcast that he doesn't hit his kids. I'm with you, bro. I'm with you. I've never hit my kid once. Why? People say, spare the rod and spoil the child. Violence upon a child is about the abuser. I'm sorry. We have shaped our son's behavior. He ain't perfect. Trust me. He's got that. My wife is a strong-willed individual as I am. He's got that. So we shape his behavior in a way without violence. We're not, wizards. We just made a decision. We're not going to hit him to shape his behavior. Do we talk to him about it sometimes? Absolutely. But great, Diego. Thanks, man. Let's see here. Just want to get back to Richard. Cannabis has helped me kick 20 years of benzos. Oh, wow. We're running over an hour here, and I'm being told that sometimes they're too long. Cannabis has helped me kick 20 years of benzos. Great dependency and allows me to interact with the public without getting overwhelmed and agitated. Beautiful, bro. If it's working for you, if you're managing it, if you're not creating a dependency or abuse, remember, there's no definition in the mental health book, the DSM, for you're an addict. It's either dependency or abuse. And I'm going to do a show on how to tease that out. But if you feel it's helped you, benzodiazepines is what he means by benzos, they don't even let them in prison anymore, guys. Okay. Benzos are extremely addictive. They work on your I can't think. Your spinal cord, what's that thing called? I don't know. But it works on your nervous system. Sorry, it's a long day. Nervous system, and it causes extreme forms of side effects that once you get off them, you have like these like zaps. They call them zaps, where you're like, so great, Richard. If that's working for you, great. Keep working it. Okay, excellent. All right. Well, listen. Yes, it sounds like the father of my kids. Good. You guys keep interacting with it. Angie is asking, can a person be a narcissist to one person and not to others? Great question. I'll close out with that. Yes and no. Again, remember, for you to have narcissistic personality disorder, first off, you're in maybe 3 to 5% of the population, or somebody is, which is very low. But you got to have that lack of empathy. So if a person has empathy, meaning that you feel maybe they don't care about you as much as they could, but you feel that they care about you, they're not a narcissist. So what you may be seeing is that they're one way with one person and one way with another based on their relationship to that person. So can a true narcissist be a narcissist to one person or another? Absolutely not. Absolutely not. A narcissist is a narcissist, and that is a personality disorder. And there's some people who believe personality disorders can never change. I have a different view on that. I genuinely feel that anybody who wants to make a change, anybody that wants to heal, can do the work and make the change. Okay. So, Rose is saying, I've changed so many doctors because they misdiagnosed my psyche, and all because of their lack of experience and lack of knowledge in the real world. Exactly. So Rose, you absolutely could be an excellent mental health person. Keep healing that trauma within you. You got to work on that issue. My catchphrase that you guys have heard me say, it's a little corny, but you got to feel it to heal it. Okay. If you don't feel it, you're not going to heal it. If you're in denial, oh, I'm fine, I'm not, it's not going to heal. So again, guys, thank you for all your questions. Please share this. Please bring more people in. I'm still going to keep the Monday, Wednesday, Friday, as long as people are logging on, as long as people we're able to engage with each other on what our mental illness is. So I'll see you guys Friday night again. Frederick, thank you, brother. I appreciate you watching this. Please share this. Frederick, do me a favor, man. If you like these, please think of a question and log on Friday and ask it. Okay. There's a reason you came on. And I know we're talking about stress and we kind of delineated a little bit, but so thank you. Last thing I'll leave you with, guys, do not give up on your ability to heal. We have no clue what healing is. Why do we heal? Why does a cut heal on our arm? What is that? Why does that happen? We don't focus enough on that. I know people say, well, we're biologically wired, and if we didn't feel, well, why? Why do we heal? I ask this to my physician friends all the time, and I'll say, why do we heal? And they say to me, well, we heal because we're... No. I didn't say, how do we heal? I said, why do we heal? Okay? So anyway, do not give up on your ability to heal, but you got to do the work. You got to accept, yeah, I got some pain in me. Yeah, I got some mental illness in me. There's nothing wrong with it. Who doesn't have mental illness in them, people? Who doesn't? Name one person you know who doesn't have a degree of mental illness. Work on it, accept it, and work on it. Okay, Rose, thanks again for your help. I appreciate you logging on. And yes, stay positive, and it's okay to be negative. Remember, it's okay to have negativity. It's okay to have negative things. We need to just work on them. Okay, so thank you for logging on. Please share this. I'll see you Friday night, 9 o'clock Mountain Time. All right, good people. We'll see you then. Take it easy.